We're going to be live and we are live now. Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Assalamu alaikum. My name is Dr. Muhammad Farooq Nizam. I'm a neurologist in private practice in Edison, New Jersey, and part of the Masjid Al-Wali administration. This is, I think, the fourth series of our community health specials on COVID-19 presented by Masjid Al-Wali, and we want to thank you all for joining us. I would like to start by thanking Masjid Al-Wali and the New Jersey community, which has been practicing social distancing and helping to reduce the amount of coronavirus cases in our vicinity. Right now, it has been known that a lot of the cases are coming from religious places, and in our community, the numbers are not as severe as some of the other townships, based on what the data we are seeing. As of today, it has affected worldwide over 88.2 million cases with over 1.9 million deaths. In the United States, there are 21.7 million with over 365 deaths, while New Jersey has over 565,000 affected cases with over 19,000 deaths. Middlesex County itself has over 50,000 reported cases with over 1,700 deaths. I was not able to pull out the numbers for Edison itself, but in our local community, those are the numbers we are looking for the reopening of the masjid. As you all know, New York and New Jersey were hard hit early on, and then there was a lockdown period after which the governor's mandate did work, and we saw very little new cases. But then during the summer, with the reopening of the beaches and restaurants and other places, the numbers started to rise. The cases in other states like Texas, California, Florida, they are in a crisis state. They don't have enough ICU beds. They don't have enough staffing, both physicians, nurses, ancillary staff to support the surge. In New Jersey, we anticipate a surge over the next few weeks due to the recent holidays. And we wanted to give a medical update on our clinical experience since the epidemic began. We, as a community, can continue to ask you to keep up the hard work that you're all doing by adhering to the guidelines from the state, and that will help reduce the cases in the near future. This talk that we have, we will divide it into three parts. The first part will be COVID updates and overall experience over the past 10 months, and we will also briefly discuss about the new strains coming out. The second part will be about the vaccine, its indications, contraindications, the myths example. Some people have said that there's a chip implanted within the vaccine for tracing. Also, some theorists have suggested that there's genetic components to alter the DNA, and also some many long-term side effects, which are all myths, and we will try to review all of those myths. And then finally, we will have a Q&A session from the public, whatever we can answer. I would like to now introduce two of my esteemed colleagues who we've had previously on this format. They are the frontline workers in the hospital dealing with this pandemic. Both of these colleagues of mine have seen over 1,000 patients since March of 2020, and they have extensive experience in all the various presentations about this virus. First, we have Dr. Mohammed Hasham, who is an infectious disease specialist at JFK Medical Center, but he also goes to Brighton Bay, Old Bridge, and Perth Amboy. He's board certified in internal medicine and infectious diseases. We also have Dr. Mohammed Zubair, who's a board certified in internal medicine, pulmonary medicine, critical care, and sleep medicine. On behalf of Masjid Al Wali, I would like to welcome both of you and also thank you for the time you're taking for this important discussion. So we'll start first with you, Dr. Sham. Since we talked last, this was about 3 months ago, there's a lot of things we've learned about COVID-19, and also if you want to add what the new strain is about, uh, elaborate on that, about your thoughts.
Yeah, so Assalamu alaikum everybody, and thank you for having me here. The new strains that are in the news now are the UK strain and the now South African strain. The UK strain and the South African strain, the concern is that they're more virulent or stronger than the original strain that we know of. It's not surprising that these strains have come about. Coronavirus as a virus, just like other viruses, they mutate, they change, they adapt, they see what's going on around them. If they notice that things are going against them, they may want to change themselves and try and survive. That's what they're trying to do. Also, if a virus or even bacteria is around long enough, inherently there will be changes as it spreads, as it um, reproduces, as it changes itself. There are going to be small mutations in its own genetic code, and those changes or those mutations are what uh, end up causing resistant viruses and bacteria. And the concern, obviously, is whether or not these new strains will be more likely to cause worse problems in more people, and ultimately whether or not we're going to be able to test for them with the tests that we have available, and whether or not the vaccines that are available will protect us against those new strains that are out there. So just this is still a very fluid situation, and just I believe today, this morning, I heard that they were able to recreate the South African strain in the laboratory and test it against the vaccine, and it did protect. Now, I haven't seen the report myself, but this is what I've been told via reports that were shared to me, so by the news and others. So, if that is the case, then that is very good news. But we have to see that to be sure. But I don't think that this is going to be the end of mutation. There's a chance that there'll be other mutations and other strains of this virus, and it's nothing that anybody has done wrong. It's just the nature of the virus. They will change, and we have to be careful and continue to do everything that we've been doing up until now to protect ourselves and everybody around us by continuing the basic principles that we talked about in the first series of these talks, with social distancing, wearing a mask, hand washing, and cleanliness. All those things are just as important today, if not even more important today, with these new strains as they were when we last spoke the first time.
Okay. And Dr. Zubair, you're seeing over 1,000 cases in the hospital. Are the presentations any different? Are the treatments that you've been using been more streamlined, more uniform? And what are the outcomes that you're seeing with the new treatment protocols?
So the changes what we've seen from the last 8 and 9 months, presentation really is not the difference. It's still the same presentation, symptoms of headache, body aches, pain, losing your taste, smell, could be fever, nausea, vomiting, feeling foggy a little bit. These are the common symptom we are still seeing, and the worst symptom comes in when you have a persistent cough, sore throat, chest pain, at that level become serious symptoms. Symptoms are the same, but some other things are changed, which is some of the treatment or new understanding. Basically, treatment was there, and one of the main thing is monoclonal antibodies, which is if patient has a high risk, elderly, diabetic, high blood pressure, heart disease, lung disease, and still have a normal oxygen, they are candidate for monoclonal antibodies, which is some of the hospitals, I believe Robert Wood Johnson, Beth Israel, Hackensack Meridian, some of them you can go into emergency room, they will evaluate you, and if you qualify, qualification is that your test should be positive within few days of the symptoms, not that 7 8 days you've been symptomatic or test positive, now you can go and get monoclonal antibodies. You need to get to ER. I just sent one of my patient today at Beth Israel Medical Center. She was positive yesterday, has asthmatic, she's about 70 years old, and went to emergency room. They repeated the COVID test, was positive, and she got monoclonal antibodies. And I believe she's already home, did well, and went home. So that's something which is first 2 3 days you want to give it. And I just want to share with the community that you should, if you are infected and you are high risk and elderly comorbidities, you should call your primary care physician and ask them where I can go for monoclonal antibodies. Other treatment which widely available, our understanding became very different compared to 9 months ago. Now, when the people are symptomatic, we are using steroids, we are using remdesivir, we are using anticoagulation, blood thinner at a certain level, and the last one is, of course, is a supplement oxygen. So we're seeing by using these cocktail of medication early enough in the disease, we are seeing the patient overall, I believe, in my experience, they're doing better. We still have a patient, even after doing all these things, not improving and continually deteriorate to the level that they die. We do not know why they go that pathway other than yes, they have comorbidities, yes, they are elderly, but it's still point where we are trying to figure out it is individual genetic makeup of human being which affecting them such a way. That's why this disease is still very serious disease. There are patients, hundreds of them lying in the hospital and in ICU dying, and there's very little or in those patients we can do. So we need to continue consider this disease a very serious, take it very serious. And even if you're younger, we've seen patients in 40s and 30s and 50s dying, and we've seen elderly surviving. So you cannot say I'm 40 years old, healthy, it's okay for me to get exposure, I'll be okay. No, it is a serious disease, and you do not know who will have a bad effect. At a point, there no treatment. End of the day, I want to emphasize we still do not have a treatment for COVID-19.
One question I was discussing with the emergency room physicians yesterday, and they are telling me that, of course, the numbers are going very much up and much higher than what we were seeing in March and April, but they are discharging more patients from the emergency room home. Yes, the admissions are still there, but the volume is definitely higher, but a lot of them are being discharged. Hasham, are you seeing that also from the emergency room?
Yeah, it's a mix. Some of them are. I think it also depends on the comfort level of the ER doctor, how comfortable they are with sending some of these people home. So we don't really get involved until they're admitted. So I'm not sure, if you compare the percentages of how many people are being sent home to how many people are being admitted now than they were in March and April. But we'll say this: they're not testing everybody anymore either. If they're coming in and they have symptoms that are consistent with COVID-19, they may not get tested. They may be, and if they're okay, meaning they're stable with their blood pressure, their oxygen levels are good, uh, and they're not requiring any oxygen, and they're not being admitted. They may not even be tested. They will be advised to go home and quarantine. Now, the issue of testing and the tests and the reagents and all those are are still a problem for us in terms of supply. So one of the things that they're doing, and it may be all hospitals, I'm not sure, but I have seen in the ones that I go to, not everybody's being tested. They are being advised to go home and quarantine unless they're being admitted for something. So if their oxygen level is low or they have high fevers or whatever reason it is and they're getting admitted, then those patients are being tested. So the percentages are going to be not accurate because a lot of people are going home, but a lot of them are not being tested.
Okay.
Dr.
Um,
Nizam,
yeah.
if I may emphasize on that point, which I think probably my first answer will confuse, Dr. Hasham is right. What the policy of many of the hospitals are, if you go and say, I have headache, I'm short of breath, or I don't feel good, they will check your vitals. If your vitals are stable, they may do X-ray too. If are stable, negative, they will not do COVID test on you. They will do COVID test on you if they feel they need to admit you because you are hemodynamically unstable, you are hypoxemic. So if you feel that you have a COVID, you don't have a symptom to be admitted, that major symptom is hypoxemia, chest pain, shortness of breath, then you rather go to your private doctor or call them and ask where I can be tested. Once you have a test positive and you have a comorbidities, then you should contact with the doctor where I can get monoclonal antibody if you think you qualify for it. So that's why some of the patients are being returned from emergency room without even testing. And other is, if you do not have hypoxemia, you do not have pneumonia, there is a good chance emergency room will send you home and say quarantine yourself. And if your symptom get worse, like shortness of breath, chest pain, change your mental status, you become lethargic, then you come back.
Okay. Dr. Hasham and Dr. Zubair, either one of you can answer. There's a question that says, is it too late to take monoclonal antibody if the symptoms are there for 10 days and the patient is 49 years old?
Yeah, so there's criteria from the FDA because it's under EUA, so under emergency use authorization for the monoclonal antibody. I mean, you could find it. I think the age of 49 without any comorbidities may restrict them, but I haven't memorized all the criteria offhand, but
Okay.
we could find that.
Okay.
The,
Um,
here is the answer is part of it is if 45 years old do not have any comorbidities, they don't have any severe other symptoms, and they have a symptom started 10 days ago, and the blood test was done 10 days ago and the COVID positive, they will not consider them. Now, if symptom started last 3 days, 4 days, and the test was done 2 days ago, within 48 to 72 hours, they can be considered if they have comorbidities. And that's a heart disease, lung disease, high blood pressure, diabetes.
okay. One other thing that I wanted to talk with you, Dr. Zubair, before we started this talk, you were mentioning, we were discussing why have we still kept the masjid closed? The numbers are increasing. You also had said that there were now you're seeing family members being admitted. Can you expand on that a little bit about, and also why the decision to close the masjid was made, and how did we make that decision?
So what I personally looked at it, and statistic we looked at it, since April and in March, things are changed, how the virus is being spread, and who are those patients who are being admitted in the hospital. So I can tell you last 4 to 6 weeks, what we see in the hospitals are, I have people coming in as a family, and you ask them, where you get exposed? One of the common answer which I'm getting for the last few weeks is, I do not know. I've been home with my wife. I just went out one time to the bank or went to the post office, or 2 times I went to the shopping for the supermarket. So where the virus come from? People are not going to birthday parties. These people did not go to crowded places. So where the virus come from? So now we realize that it is the families, outside member of the families coming and getting together. Now, if we go more detail and look at it, statistic in the whole country right now is the faith-based community is the key component into it. The highest number of COVID patients from the last 8 weeks coming from faith-based community. How it is, if 10 people are coming in a faith-based center, so those people are 10 are from different families. Those are 10 people bringing the highest level of exposure from different part of the households. The chances are you really getting exposed not only those 9 and 10 people, each family person been exposed to 10 or 15 other people. When you put number together, it becomes very high number, which you are getting yourself exposed if you are in that faith-based community. So end of the day, now if you remember, governor said no more than 10 people, even at your own home or gathering should be. He left the faith-based community alone because of political reasons. But us as a community, it is very important, and I think I feel very good about it, that we as a community and the physician in the community able to guide our Muslim-based community, let them know that how it is spreading. And we done well. You can go right now in the JFK hospital, which is based in Addison, for example. You'll be surprised that percentage-wise, the community we done well. And that is really credit to the mosque leadership to guide them what we need to do. Some other community who did not do what our mosque did, or other churches or mandir, other faith-based community, regretting it, and they are virus spread. Now we know there are people spread in our community, but they were quarantined. They did not come to the mosque because it was closed, and I think we really saved the spread to the community. Now, people can say, well, I'm young, 40 years old, 45 years old, but you are young, 40, 45 years old, going home and your parents are home. You are coming, and young people who are asymptomatic. This virus could be asymptomatic the day you get exposed to up to 14 days. You can carry this virus and do not have a symptom, not a single symptom, as possible up to 14 days. And that 14 days you could be spreading this virus. So I think it was very important and the right thing to do. I really admire that administration was open to this idea. I think like you guys both, Dr. Hasham and you said, that next 2 weeks going to be very important, and the peak did not come yet. Peak is going to come yet. So people who are exposed in New Year, in a Christmas, those people gonna be coming to the hospital next 5 to 10 days. And mortality and morbidity gonna go high. And I will continue preach and recommend to the all community. Yes, faith-based community has to be concerned about it. I will recommend all the community at their own homes. Let me give you an example what's going on at the home level. Home level is people said, well, we were quarantined, we were home, our kids came, dropped the food in the door, and they left, right? People get fatigued, and the parents start sneaking out, going to the supermarkets. They will go to the bank because if they deposit the check. And those people are coming now with the COVID in the hospital. And they are not coming alone. They are coming with the wives, the husband, the grandkids, and the son and kids. Like Dr. Hasham and me, we are sharing people right now at the hospital. Whole family is there. Some survive, but one or two here and there dying in a one family. It's a devastating. Can we avoid it? Yes, we can avoid it. What we need to do, we all know. Stay 6 feet distance, stay socially distanced as much we can. And yes, mask is part of it, and other gatherings should be part of it.
That's very good advice, Dr. Zubair. We'll move to the second part, which is the vaccine. Dr. Hasham, can you just talk a little bit about how the vaccine works and its indications and contraindications? And then we'll later on talk a little bit about the myths about the vaccine.
Dr. Hasham, you're mute.
Um, we can't hear you.
Sorry, I put it on mute. There are several vaccines that are out there right now. The two major ones that we have locally in the U.S. are the Moderna vaccine and the Pfizer vaccine. These are both what we call mRNA vaccines. And then there's the one that's being used and was approved in England as well, which is the AstraZeneca, I believe, the viral vaccine, vector vaccine. So um, we can talk about the one that we have available here, which is the mRNA vaccine, because there's a lot of concern in the community, certainly in the communities that we live in, and also within our own physician communities. There are a lot of questions about the efficacy of the vaccines, the safety of these mRNA vaccines, and the long-term effects of using a vaccine and this kind of technology. So the mRNA vaccine, essentially what it is the technology has been there for about 20 years. They've not used it for this purpose until now. And what it does is they deliver with mRNA, which is what they call messenger RNA, part of the genetic material, but not the full virus. They deliver part of it to the muscle cell. When you get injected, it goes into the muscle cell and it sends a signal to the cell to create the protein that is recognized by the body um, of the coronavirus. So you're creating that part or something as similar to that part of the virus, and it will be presented to the cell, and then they'll form antibodies against it. The concern that has come up is when you're injecting these kinds of genetic components, will they be embedded? Will they be taken up into the cells and be stored in there? And as the cells they duplicate, they replicate, and if these components are embedded into the cells, will they spread as these cells um, separate and spread themselves? And the answer is no, because what it does, it's quite ingenious what they've done. These scientists, they've found a way to have the mRNA get into the body, into the cell, and avoid the powerhouse of the cell, which is the nucleus. It avoids that part. It doesn't go into the nucleus, and it goes to a separate part of the cell called the endoplasmic reticulum. And but point is that it avoids the main part of the cell. That mRNA then will lead to the body creating the uh, the protein that's going to be presented to the at the surface of the cell for the antibodies to then form. Now, the mRNA itself, after it does this, will be degraded and it'll be gone. And there's no concern at that point that it will continue to replicate in these cells and it'll be stored there for the rest of your life and can be spread onto your offspring. And that's just not the way it works. Like I said, it's very, very, very smart the way that they've developed this. Now, the traditional vaccines, I mean, just to speak on efficacy, the vaccines, these Moderna and Pfizer vaccines, we're talking about upwards to 94, 95% effectiveness in preventing, uh, the coronavirus. I mean, that's from a vaccine perspective is amazing. If you think about the flu vaccine, you're talking about 30% effectiveness. To triple that with this technology, it's revolutionary. And if you can extrapolate that into other diseases such as HIV and others, and if that technology, if you can harness that technology and use it for these other diseases, it'll be completely change the way we are able to manage these problems going forward. But for that's obviously we're talking about things that aren't there yet, but just things that we can hope for with this new technology. That's how amazing this technology is for the vaccine world and for vaccine science. Now, the quote unquote traditional vaccine, where you have a live, you have a virus that's what we call attenuated or weakened down. That's being developed and worked on as well. And then there are other ways that they're doing. There are about four different kinds of pathways that are being looked at least that I know of. And the mRNA one is right now the one that's the most effective that I've seen. The one that's being used also that was approved in the UK is depending on how many doses you get, anywhere between 70 to 90 something percent effective as well. So we have a lot of options. Thank God for vaccines. The problem isn't going to be the vaccine. It's the problem is going to be getting people to get the vaccine. So, one of the things that I advocate for is for everybody who can to get it. Now, in terms of, contraindications, the CDC, has listed things that, contraindications in terms of, people who have ever had any kind of mRNA um, injections, if they've had reactions to those vaccines or to those injections, that would be a contraindication. There's not a lot out there that in terms of who can't get it. I don't think they studied, in the pediatric population or also, in pregnancy and in breastfeeding. But I think in the UK they actually gave some guidance on how to manage that in those women about maybe holding off on the vaccine, but I don't think we have very clear guidance on that here. I think the recommendation is those of childbearing age to get the vaccine. Um, but and then the question comes up, and it may be a question that somebody may have: well, if they had COVID, can they get the vaccine? Absolutely, they can. They should get the vaccine because we don't know how long your antibodies are going to last. And when can you get the vaccine? If you look at CDC, they say as soon as you're off of the quarantine guidelines for 10 days plus 24 hours symptom free, you can get the vaccine. But if you want to hold off, you can hold off for up to 3 months because that's what they've seen in the studies that the antibodies can last up to 3 months from when you had the disease. And then you can get it after the 3 months, you can get the vaccine if you wanted to wait. Obviously, if you have COVID and you're going through COVID at that time, you shouldn't get the vaccine. You have to wait until you're symptom free, and at least the 10 days, 10 to 14 days when you're off, with the quarantine. So those are really the main things in terms of who can get it, who shouldn't get it. And I think as time goes forward, we'll get more guidance on, and because more things are coming out on a daily basis with the vaccine, as more people are getting it, seeing more, more issues that they're coming up, in terms of allergic reactions and those things. But from what I've seen and heard, there haven't been many issues, thankfully. But there will be. We're not surprised when there is a reaction. That's part of getting a vaccine. There are going to be people that have reactions to it, and we have to make note of it and see what the deal was with what happened with them. Also, people say that, well, I got sick after the vaccine. Well, I mean, that's part of what's supposed to happen. You're supposed to get some kind of a reaction to it because the body is making antibodies, and you may have a mild illness such as a low-grade fever or fatigue or muscle aches, joint pains. That's part of the process of having the antibodies start to rev up because you're manufacturing part of this virus inside of you so that your antibodies can build up. So that's also expected.
Okay. One of the things I just wanted to clarify to the audience that there were some myths. One of them is that as you just to summarize what you said, the vaccine basically it triggers the immune system to develop protection against the disease and sort of develops immunity to the virus. But the COVID vaccine will not give you COVID-19. It's not a live virus, so the chances of you getting actual COVID-19 is not there, and also it will not cause you to test positive for COVID-19, and it will not alter your DNA. One of the also there is no microchip in it to monitor where a person is doing or going, and there is no DNA modification that has been is one of the myths. Um, Dr. Zubair, before you add your comments, there are two questions. One is which Dr. Hasham already answered. Do you have to take the vaccine if you already have the antibodies? And you said basically that yes, unless you're actively having the disease, you should wait at least 90 days. But if you have the antibodies, then you can continue. The second question is, can I get the vaccine? No underlying conditions, but my mom is 85 years old with Alzheimer's and lives with me. And the third question is the vaccine lifetime effective. Dr. Can you touch on those?
So the first question which you have, if you have a COVID already, you have antibodies, if you have to get the vaccine. No, you don't have to get the vaccine. Recommendation is you should get it. We don't know how good those antibodies are, but if you like to wait, study shows you probably immune up to 90 days. So, a little complicated answer. Yes, recommendation is you should get vaccination unless you are actively sick, which Dr. Hasham alluded is, if you have a symptom of COVID virus, you should not get vaccination. But if your symptoms are finished, 14 days, done with the acute symptoms, you are recovered, now you have antibodies, you should get it. If as a physician I have COVID, I had symptoms, done with it, now I have antibodies. The recommendation is I should get the vaccine. If I do not want, you have a choice. You are protected up to 90 days. That's what our thinking process is, that after 90 days, you should get it. So answer is yes, you should get it if you have available and you are high risk. Yes. What was the second question, Dr. Nizam?
Can I get the vaccine? No underlying conditions, but my mother is 85 years old with Alzheimer's who lives with me.
That if you should get it because your mom lives with you.
Yes.
So, can I just add one point? There's some confusion about or misconception about the protectiveness of the vaccine. Just because you get the vaccine does not mean that you cannot transmit the virus, and that doesn't mean that you stop wearing a mask. So you are protected against the virus, meaning the effect of the virus. You can still get the virus. You may have a milder illness or no illness at all, and it's up to 95% effective. There's that percentage that did get sick from it. But more important than that is that it's still transmittable to other people. So, those people that get the vaccine, that doesn't mean you stop what you've been doing with your mask and your social distancing and your hand washing, because you can still get the virus and you can still transmit it.
So if I just go over the question is, let me give example. If I have the vaccine, so I have antibodies, I'm protected. No, I'm a high risk. I go and see COVID patient every day, and I get exposed and do not wear my protective gears. I can carry the virus in my nose, in my eyes, in my mouth, right? And the virus can be there for a couple of days. We know that. And if I sneeze and go close to my family and sneeze, and my family is not protected, yes, there is a chance that I can spread the virus to my loved ones or people who are around me, even if I am immunized. Which is more important is, if the mother is a elderly high risk, she should be at a one point when CDS recommend should be immunized before the young person who is coming close to the mother.
And also, the next question is the vaccine lifetime effective?
No,
No,
as far as we know, we're not.
so
Sorry,
far what
Dr.
we know
Zubair.
is not, and we don't know how long it is effective. We know it is about 30 days or so is effective, but beyond that, we don't know yet.
Okay.
Right.
Just one thing I just want to tell about the vaccine, that when a person gets a vaccine, I mean, right now we have emergency use authorization. Once you get a vaccine, there's a questionnaire that a person goes through before and after the vaccine is given. In Pfizer, it's 3 weeks you get the second dose, and in Moderna, it's 4 weeks after which you get the second dose. But after the after each injection, a person can get a reaction within 15 to 30 minutes, and that's why they have you monitored there in the setting, so that if there is, God forbid, any reaction, it can be taken care of very quickly. Dr. Zubair, can you tell us where vaccines will be available and how people can get them? I know for the doctors, the nurses, and the hospital staff, the hospitals are working on it. But the rest of the community, how will they be able to, and where will they be able to get it in the Middlesex County?
So it's the state by state and the county by county it is going through. And I think they're creating the centers which include CVS and some of the drugstore will have availability. And what I know of that government and counties are working on it, they want to give to at a certain center. There's 5 or 6 center being named, including one going to be in Raritan Center in Edison, which is in Middlesex County. That will be open for the community at one point. Right now, they're opening that place for healthcare worker and private offices, healthcare related worker who cannot go to the hospital to get the vaccine. Similarly, CVS and other stores will have this vaccine available as long as you are registered and you qualify. Qualify means you are high risk with the healthcare worker, and then as the vaccine get more available, I think they will expand it to the first line worker, police officers, and similarly other community who are high risk, and that will be announced as we go along, that who will be next phase.
Yeah, I was just looking at the numbers. I was told by looking at the NGGov website that in December we had over 400,000 vaccines delivered, and in January so far 106,000. So it's about 506,000 vaccines already delivered, and they're coordinated efforts with Rite Aid, CVS, Walgreens. There are about 500 long-term facilities, and then there will be mega centers like Dr. Zubair mentioned, the Expo Center in Raritan, which will be giving the vaccines. I was looking at their schedule also. Right now, they're scheduling the vaccine initially started to be given on December 15, 2020. And initially in 1A, it's healthcare workers, which are being immunized as we speak. All three of us, I know, we got our first shot, and I think by next week we'll be getting our, inshallah, the second shot. The 1B is basically law enforcement officers and firefighters with essential workers and other high risk individuals, and those above age 75. I think that's starting maybe next week or so. And then 1C would be essential workers and people above 65 or people 16 to 64 with medical conditions. And then level 2 will be the general public. So one of the things is that there is the New Jersey vaccine scheduling system, and if you go to nj.gov, they will give you where you can register for all of these the vaccines. Do you have any closing comments that you want to say about this, Dr. Hasham? First, we start with you.
Yeah, just I would just reiterate how important it is to continue being as safe as possible. Dr. Zubair mentioned the fatigue, what we call COVID fatigue, people just getting fed up and tired of doing what we've been doing since March in protecting ourselves. But the next couple of weeks are going to be probably some of the worst in terms of numbers since the pandemic began in March. And I can't emphasize enough how important it is to continue being safe and practicing the social distancing, the mask wearing, the hand hygiene as we try and get through this winter. And inshallah, with the vaccine rollout and improvement in terms of getting the vaccine to everybody that needs it and wants it, we can achieve enough of an immunity that the community will be protected. Until that's done, and that could be many months away from now, we have to continue to be vigilant and we have to continue to stay strong with everything that we've been doing to protect ourselves and our loved ones. And I would please advise everybody, this is this is a devastating, potentially devastating disease that can kill people and does kill people. And Dr. Zubair mentioned it. We don't have a cure. We have treatments that may or may not be working. We don't know what they're doing and when it's going to be more effective. And we don't see a cure anytime soon. So the best thing you can do is to protect yourselves and protect your loved ones. And please, that's what I would advise everybody to do, is please take this seriously. It's not a hoax. It's real. People are dying so much every day. The numbers are going higher and higher, and it's just unbelievable what we're seeing. So I would advise to do that and to stay safe. That would be my biggest statement.
Dr. Zubair?
So I will stress again, as Dr. Hasham said very nicely, what this pandemic is about. And I tell you, still one of the best preventive measure we can have is social distance, washing hand, staying away from the crowded places. That is the best thing. I can just have the images in front of my eyes of those loved ones when they see their family member dying in this ICU on the floors. I tell you, they wish they'd done extreme prevention measure and they didn't come to that level. I talk to them on the phone, tell them how the loved ones is doing. I spoke to a couple of families today. I can really feel their pain, how they are suffering, that their loved ones are 60 years old, 55 years old, and I can just say, just pray, and we're doing everything we can do for them. The people who are not infected and sitting home and listening to this, you have the choice right now. You can do that extreme measures, which is very simple, and we can avoid devastating death, and it is not a pretty death. This is a devastating when people get this disease, fever up to 103, and the people who recover from serious disease, when you talk to them, they say, God, I hope God doesn't give this disease to our enemies. That's how bad some of the people are feeling. I can't stress enough on the community to say, please don't let this COVID fatigue get to you. Please stay quarantine and distance from each other. Please avoid crowded places as much you can. Don't drop your guard, please. Be careful. If something happened, take a responsibility. If you have a fever, you got exposed, quarantine yourself from your loved ones, from your people you know. This is a chain reaction. This virus love you if you talk to each other, spread each other, mingle with each other, be guest of each other. I can give you example. Just one of the family member died. The husband has a visitor at home who came for tea. Husband get infected. The wife had a medical issue, lung disease, and she got it. Young woman just died because husband had a tea with a close friend, not knowing, friend did not know he's affected, right? And this lady, housebound for last 8 9 months, she's dead. So my point, what I'm trying to make to my community is, do not let this fatigue get to you. Be very cautious when you go out. Use your PPEs, mask, use your all the precaution you can. And if you feel like you went out, you are in the crowd, you come home, stay distance from your own family. If you have a symptom, separate yourself from your loved ones, from your community, and avoid getting the disease. We are the winner. Thank you.
Thank you very much. I just want to add a few things that over when I listened to the news yesterday, day before yesterday, it said we had the highest death toll in United States. Then when I listened to the news yesterday, the number said yesterday was the highest death toll. So every day the death toll is dramatically increasing, and the next few weeks are where the surge is expected. So, what the Dr. Hisham and Dr. Zubair said is very important about social distancing and maintaining, isolation. One of the things that I do want to add is that in my practice, and I've spoken to a lot of cardiologists and a lot of other physicians, we are now seeing the late symptoms coming in those patients who were asymptomatic or mildly symptomatic in March, April, May. As a neurologist, we are seeing some bizarre cases, headaches, dizziness, memory problems, neuropathies. We are seeing psychiatric illnesses, psychosis, delirium. Now there's studies that schizophrenia has been identified in short-term illnesses, strokes, brain bleeds, vasculitis in the heart. We're seeing inflammation of the heart. All of these things, and we're not even talking yet about the primary source, which is the lungs, which down the road we will see what the effect of that is. So the main thing is prevention is the key, and getting the vaccine is a great way to protect yourself and the rest of the people. I want to thank both Dr. Hasham and Dr. Zubair for updating our community on this very serious issue. Please maintain your social distancing, wash your hands, wear a mask if you go out, and call your physician immediately if you do not feel well. If you are having high fevers and other symptoms, then you may be eligible to get some of these antibodies. So talk to your doctors immediately. Also, from Masjid Al-Wali, over the next week or so, we will be reevaluating when to reopen the masjid based on the numbers that we see, the infectious numbers, and also the numbers in around the area. I just want to ask all of you to make prayers for all the medical professionals, the first responders, all the frontline workers, as they're risking their lives to protect and serve the community. And I want to thank you all for listening to this week's Masjid Al Balawi Community Outreach Program. In a few weeks, again, we will give you an update. May Allah subhanahu wa ta'ala protect us all. Jazakallah khair. Thank you so much.